So I am Brian Adriano and I will be performing the urinary catheterization. So here are the materials needed for the urinary catheterization. One is the drape, to maintain sterility of the work field, or the plastic cover, the gloves, the needleless port, the normal saline solution uh, in the syringe, the urine bag, the cotton swab or the cotton applicator or applicator sticks, and also the polycatheter that is will be using in inserting the urinary catheter, and also the tongue, kidney basin, the normal saline solution, C, to hold the catheter tube in the inner thigh of the patient, the cotton balls, and also the gauze pad. Now, what are the contraindications for the urinary catheterization? It is the gross hematus, urethral pain or discomfort, especially the urinary tract infections. So those are the contraindications for the urinary catheterizations. So first, we must verify the patient if he or she the patient that will be inserting the urinary catheterization. So are you mom? Ma'am, may I know your name? Are you Pamela Anayes?
Yes, I am.
21 years old,
Yes.
and you are here to that the physician ordered you to insert a urinary catheterization.
Yes.
May I know if you have any allergies from the following iodine and the related
Mm.
latex?
No, I don't have any allergies.
Do you have experience in or encounter in having a difficult in inserting? That
No.
did you already experience or did you undergo before the procedure of urinary catheterization?
Never.
So this is your first time.
Yes.
So this procedure will be, I will be place you in position in the supine position with your knees flexed, and then and the frog or abducti. So I will be exposing your vagina, your labia, and your perineum. If it's okay to you, ma'am.
Yes, it's okay.
But before that, I will be providing you a privacy by closing the curtain. I'm doing my hand washing and the sterility of my hand. And after all, I will clean I will clean your labia or your perineum. So now I will, assuming that this mga assuming that this is the vagina that will be exposing, put the drape. Ano? Drape using the gauze pad or the cloth, and then using the NSS. I will be cleaning the perineum. I will be exposing the labia or the perineum. Using the NSS or the soap. Okay. And after that, let's move on to the sterility of the procedure. Discard. Discard. Now let's move on to the sterility of the procedure. So assuming that this is the sterile gloves, I will be doing the gloving, and the gloving must be it should be not be under the waist level. After I put my sterile glove, let's move on to the cotton applicator. Assuming that the cotton applicator has already or we should put, we should put that in there. Cotton applicator. And apply it to the labia, like to one down and then discard. Assuming that it's already done applying and cleaning the perineum and the vulva, now let's proceed to the lidocaine gel. And open the catheter. Now that is the urinary catheter and it attached already in the urine bag. I will be now using my dominant hand, sterility, and my non-dominant hand to open the labia while inserting, and then let's just put some lidocaine gel so that we can easily put the catheter. At least 3 to 5 cm will be after. Now to check, we need to inflate using the needleless. And apply the balloon, and after that we pull it, the air inserted. Then after we fill the balloon that we inflate earlier, at least we insert again in 3 to 5 centimeters. Now that we feel that is already secured and attached, Now, we will secure the urinary catheter by placing it in the inner thigh of the patient using this one. Assuming that it here it is the inner thigh of the patient. And support the tube. Oh, it's the urine bag. Place under. After the procedure, we must check the urine flow in the urinary catheterization, the urinary bag and the urinary tube hose. Now that we see that this is already good in flow, and we see the urine that goes into the urine bag, it is, I can say that it is, we insert correctly or properly the urinary catheter bag. And after that, let it hold and secure into the patient's body or the inner thigh of the patient. Now, after that, we must record and document all the procedures done by the patient and as per physician's order. And then after documenting it, record all the patient's cooperation. What is the patient feel? If the patient feel discomfort and any pain after the procedure or during the procedure, and if we see blood in the urine that comes out and goes to the urine bag, we must record it, the color, texture, and the stickiness of the urine. Then after all record, documented, and then report it to the physician. So that's all for the urinary catheterization.